Thank you for joining us today. We are here with the Aligned Modern Health Digital Doc Series. Today is a conversation on pain management, and we are joined by experts Dr. Rakak Alebiosu and Dr. Shana Tully. Before we get started, we'd just like to introduce Aligned Modern Health, just in case this is your first time joining us on a digital doc webinar. Aligned Modern Health is Chicagoland's top-rated health and wellness service provider, providing support for the whole body, internal and external medicine. What sets us apart is that we really aim to get to the root cause of why you're feeling what you're feeling and look at you as an individual and a whole person, not just your symptoms or conditions. Our 18 clinic locations throughout the Chicagoland area, plus our telemedicine services in 8 states across the US, are supported by our physical medicine program, which includes chiropractic care, injury prevention and rehabilitation, athletic performance support, and clinical massage therapy. We also offer acupuncture, which can be really amazing to benefit physical pain, which we'll talk about a little bit, but is also really important to benefit some intangible kinds of things like stress, anxiety, depression and PTSD, sleeplessness, insomnia, seasonal allergies, men's and women's health. We have a nationally recognized pregnancy and fertility program. So acupuncture can really help some physical ailments, but also some things that are a little bit more intangible sometimes. We round out our services with our functional medicine and nutrition team, which is a really great way to look internally as to better understand why we're feeling what we're feeling externally. We work with a lot of gastrointestinal concerns, autoimmune disorders, bloating, constipation, fatigue, migraines, hormone balancing, testing for food sensitivities, working with folks looking to manage their weight, nutritional counseling support. So really looking at the whole person to better understand why you're feeling what you're feeling, and then customizing a treatment plan to best serve your goals. With that said, I am so thrilled to introduce both Dr. Rakak Alebiosu and Dr. Shana Tully, who are going to be leading our conversation today on pain management.
Awesome. Well, I'm super excited to be here today. Again, my name is Dr. Rakak Alebiosu. A lot of people know me as Dr. Rock. I have been with Aligned for the last 6 years, and I've been practicing for the last 10. And I'm currently right now practicing at our Wicker Park location. I've been there for the last 2 years, but I've had the opportunity to work at a few of our locations in the Chicagoland area. I've opened up a location in the suburb. And so it's been awesome to work with so many different types of demographics. I'm a graduate of National University of Health Sciences is right here in Illinois, in Lumbar, Illinois. And, over the last 10 years, I really had an opportunity to work with so many different types of primary care providers and specialists. And originally in my first few years of practice, that's when I really got an opportunity to really get an understanding of pain management. I had a lot of referrals back and forth, some personal referrals from these providers. And that's what really sparked my interest. Obviously, we've been learning about this whole opioid crisis. And a lot of times, a lot of the conditions that patients take opioids for are really effective when utilizing something like chiropractic. So can't wait to, talk a little bit more about that a little bit later on and share some of my experiences.
Hi, I'm Dr. Shana Tully, and I've been working at Aligned Modern Health for about 3.5 years. Before that, I worked at a different clinic where I did both acupuncture and functional medicine, herbal medicine as well. So I have a lot more experience in both pain, working alongside chiropractors, as well as working with internal medicine docs. So I am actually on hiatus from teaching at Pacific College of Health and Science, but often I do teach nutrition and herbs. Whenever I get back to that. And then I got interested in treating pain in my research of the Lincoln Hospital program in the Bronx that this occurred in the 70s, actually became aware of it through liking the music of Tupac Shakur. So his stepdad was an acupuncturist at Lincoln Hospital in the Bronx. And that happened as a result of community demand. In the 70s, there was a flood of heroin in the Bronx, and people wanted to get off of that. So it's one of the first like opiate weaning programs in the US that involved acupuncture. And they actually cultivated a protocol that people utilized. I just got really interested in that and how that all happened, and went on to study at Pacific College of Health and Science. So I have my doctorate there, and I've been practicing acupuncture since 2015, but herbs since about 1997.
Wonderful. Thank you so much for being here today with us. I am now going to turn this conversation over completely to you so we can learn from all your wisdom and expertise.
Awesome. So I first want to start off with what physical medicine is and chiropractic care. I think that's pretty important. This is pretty much a full systematic approach of addressing musculoskeletal issues. And really the goal is to get down to the root cause. That is very important. When we think about pain, I think the first response is, what can I take to get rid of pain? But in order to really address pain, you have to know what is triggering that discomfort and get down to the root cause. So that way pain doesn't keep coming back, which is very common when you're dealing with a lot of musculoskeletal issues. So specifically, when we see patients, or I see patients at Align, the focus is on first examining that history. We want to talk about how long this pain has been occurring, what those triggers are. And from there, that gives us a well-rounded approach to really thinking about, how we could get ahead of this. It's interesting when talking to a lot of patients and I ask them, what causes their pain, what makes it better or worse? And a lot of patients really don't know. All they know is that they have pain, and then they don't even really realize when pain is completely gone. And most of the time, what they really mean by that is that they're able to do their normal activities without any disruption because of pain. And so we want to go over that detailed history just so we can get the thought process going of how we can really get to the root cause of this, which is really important when addressing pain. From there, we always will do a full detailed exam, right? And during that exam, I'm looking at things such as posture. I want to see how you carry yourself, because that's very important. That tells me what muscles are activated or what muscles are not being used properly. We want to look at movement. I want to see if there's any restrictions in movement. A lot of times people will develop restrictions in movement over time and not even be aware of it. And then we're going to do like a lot of baseline testing, such as orthopedic tests. We want to see if anything recreates that discomfort. We're going to do some neurological tests just to make sure there's good communication between the brain and the rest of the body. I'll feel the muscles and joints. And then I do what's called the McKenzie assessment. And this is probably one of the most researched assessments for spinal injuries, but specifically, it also works really good for any type of joint injury. And what we're really trying to target is a directional preference for movement. What movement makes your pain better, worse, or the same? Okay. And then from there, what this does over time when working with patients, it teaches them how to self-assess, so they can start to become more involved in their recovery process. Once we look at all those details, if we need to, we can do any type of imaging. Specifically in the clinics, we would do x-rays, and this allows us to look at more of the structures so we can see if there's any type of pathology, because before we're doing any type of hands-on adjusting or anything like that, we want to make sure that the joints are, intact, and that we're not going to recreate any other issues. Once we do all of this, this is going to allow us to basically put together a treatment plan, which is going to consist of the adjustment, which is why most people will come to see chiropractors. And that's a mobilization technique. It's going to do a couple of things. It's going to help restore movement where areas are restricted. It's going to help to improve blood flow. It's going to help to also increase what's called that parasympathetic nervous system, okay? So when most people come into the clinic, if you're in pain, as most of us have been in pain before, you're going to be a little bit agitated, a little bit, short-tempered. Your blood pressure may be elevated. We're in what's called this fight or flight response, okay? And so we really want to get that parasympathetic nervous system activated, which is more of our rest, digest, and reproduction. And that's going to just help us feel a little bit more calm, and that's going to help to decrease that pain response. And then we would also incorporate corrective exercises. We want to make sure that we're stabilizing areas that are weak, mobilizing areas that are tight through movements. And then we can incorporate massage therapy basically to allow for it to improve for circulation where there's restriction in muscles, tightness, make sure they're moving correctly. All these things, when you combine them together, does a really, really good job of helping to decrease pain and probably releasing nature's best, what we call like pain management, which is your endorphins. And all this stuff really helps to like make you feel better over time. So this is like the approach that we do when you come in for an assessment. And of course, when things are still in that chronic state where they're not responding the way that we want, or you're in more of an acute state where you're so inflamed that you need a little bit more assistance, that's when something like acupuncture works really well. So Doc, you can tell them a little bit more about that.
Sure. So happy to talk about that. Basically, sometimes patients will come first to see somebody like Dr. Rock or physical medicine department, or sometimes people directly self-refer to acupuncture. When we're talking about physical injuries, pain, either way is fine. But we do coordinate care very frequently between the two of us. So with the acupuncture, what we're looking at is we can also do some of the orthopedic tests unless they've already been done. We're looking at muscle imbalances, we're looking at your circulation, but we're also looking at your whole picture. So we do a full intake so that we can assess you to see what points would be most efficient. For example, if you have low back pain, but you also have constipation, there's a specific point that'll do both things and really just help things start moving in the lower abdomen and really just start to release the whole area. So, it can be something as simple as that. It can be also just looking at the neurology, the spine, what kind of dermatomes are involved. And it can also be like what sort of internal medicine sorts of causes can be playing a part. Sometimes we also refer to functional medicine for that, whether it's something like systemic inflammation, blood sugar control, or something else. So we're really trying to get to the root cause of why you're in pain. And so we find coordination of care is actually really important for that. So with the needling, we know that acupuncture actually causes a release of endogenous opiates in the body. So you're basically your own endorphins and a number of other like anti-inflammatory cytokines and just regulating those cytokines downwards, like sort of getting an interruption of those inflammatory markers that are just constantly being created, as well as we know acupuncture helps to regulate that fight or flight and get you out of sympathetic response and into parasympathetic rest and digest and heal. So we often coordinate care when there is like this element of psychogenic pain or like stress drives the pain, but it can be chicken or egg, right? Like the pain causes stress because you're in so much pain you can't do your job or something like that. So we're trying to, essentially help you from multiple levels at once. And then also just we're creating movement within the fascial plane. Acupuncture not only works on the muscular tissue, the nervous tissue, but also the fascial plane or the connective tissue. We're trying to create a release in that area. If you wanted to like look into the Western explanation of that, there's a great book called Anatomy Trains that talks about the fascial planes and how we can kind of create movement within those compartments. So we're just looking at it as a whole picture. And sometimes we'll also incorporate electroacupuncture, where there's different styles, different uses of settings on the machine, where, if we're using some microstim and we're doing like a deeper cellular change, if we're doing millistim, then we're looking at the muscle twitch response. We're trying to create an orthopedic shift in that muscular tissue where I'm trying to create a release of like a really stuck bit of tension. So, sometimes having the massage therapist get in there with like compressions can be useful too. And we're often coordinating care in that regard as well. Like you take the pecs and I'll take the deltoid, essentially is what we do for like a shoulder release, for example. So Brock, you want to take it away? We talk about different types of pain.
Absolutely. So I think the first thing, that we'll address is general pain. I would say the most common conditions that people normally come in with is neck and back pain. And that neck and back pain can be postural related. And what I mean by that is it could be just from like positionings throughout someone's workday. That neck and back pain can also have a disc component to it too. So sometimes people come in with a history of disc derangements, herniated disc excursions, and we basically want to make sure that people are in these type of instances are addressing both the mechanical aspect of the pain and also the chemical aspect of pain. And so what I mean by that, I always like to use like the analogy of an ice cream sandwich. The disc material has a tendency to basically move into the opposite direction that you move. So basically, if these two, I'm sorry, I wish I had my spine here today, but if this is your vertebrae on the top and this is your vertebrae at the bottom, right in the center is the ice cream. So if I squeeze one end of the joint, the ice cream is going to move this way. If I squeeze this end, the ice cream moves in the opposite direction, right? And that's how essentially the spine kind of behaves. So what we find a lot of times is that people that have chronic neck and back pain, even related to these disc issues, they're in this like anterior positioning, which basically causes a lot of compression on the joint. And so we want to find first a directional preference and movement, okay? And a lot of times what we find is if we can get them to do a movement that helps that joint move into more of a, what we call like a neutral position, that is going to help to decrease someone's pain. And those type of things we can get patients to essentially practice throughout their entire workday or day. And as they start to come back in for therapy and go through more corrective movements and work on like more of the fixated joints in which we're going to actually apply some gentle force through, we find that patients respond really well to that, and over time, just like with most conditions, if we gradually apply movement, the healing process can take place. What a lot of people sometimes forget is if you don't move correctly, you're never going to heal. So the first response a lot of times when we're in discomfort is to not move, right? And that's pretty natural because your body is trying to protect itself. But we know that movement creates healing. And so we try to get patients moving right away in a very gentle way, which basically helps to kind of stimulate that healing process. So now we're addressing not only the mechanical component, but that's going to help with the chemical response, especially if we get someone who comes in who's on like an anti-inflammatory or who's on a steroid who needs to basically address this physical issue.
Right. Yeah. And then also just to add on like the piece of the puzzle when we're talking about desk work or, sitting in a posture because you're so like focused and stressed, right? Like that's why I'm going forward is, just that like psychogenic component of it. And we often utilize acupuncture to like treat that, like the stress of just workday stress and sorting through all of the different components of your mind and your workday. Like I do find I just got acupuncture this morning. Like, it really just helps me like pull apart and piece back together in a more organized way, like what I need to do and what's like triaging what's most important to me. So like I do that for my patients as well. So, the kind of pain that like when you go on vacation, your pain goes away, but then you come back and it returns. So like that's one of the things that like acupuncture excels at treating. So should we move on to like athletic stuff?
Sure. Yeah.
All right. I just would say that like, that's something we really coordinate care a lot in. So we're looking at like just promoting overall sustainability of your athletic activity, and then also, advising on whether or not you're overtraining. From Chinese medicine perspective, we're looking at like one of the main causes of disease is like taxation or overexertion. So we want to make sure you're doing it in a healthy way. And then, coordinating care with physical medicine, chiropractic, like where are the imbalances? Like, is there enough lateral stabilization? Do I need to work on your lateral glute muscles? What's happening with the hamstrings? What's happening with the calves if you're a runner? Like, what's happening with your IT band and peroneals and stuff? So, yeah, so we're just assessing you from that whole approach. Like, if you're training for a triathlon, we're obviously looking at your shoulders and stuff too for swimming.
Correct.
Yeah.
Yeah, I would say like when it comes to a lot of athletic injuries, probably the most common thing that we see within the physical medicine department is going to be, knee related issues with runners. The marathon is coming up. We also see a lot of shoulder issues with people who do any type of overhead type of sport, whether it's like throwing a ball, swimming, volleyball, things like that in the summer. And a lot of these injuries really stem from positioning of the spine, because when we look at these injuries, we're always going to look at the levels kind of above and below. So for instance, a lot of shoulder issues, there's going to be a mid back and a neck component to that. A lot of knee issues, there's going to be some foot and hip component to that. Your spine. So we want to make sure that you also are addressing the stability component and the mobility component in those areas, because what we find is a lot of these sports, people don't do enough training to kind of address those other issues. We really want to make sure that people are kind of aware of when they are getting this discomfort. So for instance, like a lot of runners, they'll say, you know what, during mile 2, that's when I start to notice some knee pain. And so like Doc was saying, there could be an overtraining component related to fatigue. And so I always like to make sure that patients are moving in multiple planes. In life, we have a tendency to only kind of move forward. A lot of people don't do much backwards training. A lot of people don't do a lot of side to side training. And a lot of people definitely don't do rotational type training. And those things really help to create stability within your entire musculoskeletal system, so you don't get unequal pull on the joints. And a big thing I try to get patients to understand right away when it comes to chronic pain complexes is, I always use an analogy of a baby. When you see a baby that's born, babies are going to be all flexed, their legs and their arms, right? And they're just kind of curled up. And as we get older, we have a tendency to open up, right? And then, because of what we do most of the time, which is working on a desk, as we get older, we have a tendency to kind of curl back. And so a lot of times the pain that we're feeling, if it's not specific to trauma, it's going to be a lot of the compressive forces of gravity and compressive forces bringing us forward. And really what our body is asking for is activation in all those other planes to help to counterbalance some of that pull. So that's very important in understanding pain complexes.
Yeah, definitely agree with that. So we were talking about the other thing about opiates and getting people off of opiates or other types of medications. The idea with our approach to care is really a conservative care model where we're really trying to like change the body's habit patterns and move away from that without medication. Occasionally people need some type of stronger intervention. But as we know, with the level of opiate addiction crisis in this country, we really don't want you on something like that. So I was just wondering, did you want to add to that, Dr. Rock?
Well, I was going to say that, there's a lot of studies that have shown that, complementary therapies such as chiropractic and acupuncture do really well in helping to even reduce the use of opioids. And like Doc was saying before, the biggest reason for that is because of what it's doing to the nervous system and the release of these like natural pain or endorphins, more so. It's like I would like to call it, what I tell patients. And so, the more that we start to get blood flow and circulation and get things moving, the less pain that you're in and the less need for incorporating something like opioids over a longer period of time, I think is very important. And it's a great alternative. And there's a lot less side effects associated with this. And this is a big thing that we see right now that is trying to be addressed. Obviously the opioid epidemic has, destroyed a lot of people's lives, and they're trying to come up with more all opportunities for people to utilize services like ours. And so, yeah, it's been great to work with people and try to assist them in that path.
Thank you both so much for this wisdom, this expertise. I would love to reshare our screen now and open this conversation up to questions. Folks, please go ahead and type your questions into the Q&A feature of Zoom. While that is happening, we want to absolutely thank our providers, Dr. Rock and Dr. Shana, for joining us today. If this piques your interest and there are symptoms or conditions specific to you, we absolutely encourage you to schedule a free 15-minute consultation. That's a one-on-one conversation with a provider where you can ask questions that are super specific to you and get those answers. You can call us at 773-692-6700, or you can visit us online at alignedmodernhealth.com. We do have some questions coming in here. The first one is concerning a patient that experienced a lumbar fusion via surgery. Potentially chiropractic adjustments not appropriate. Dr. Shana, can you talk to acupuncture to manage that pain a little bit? And Dr. Rock, if you can chime in with some of the other benefits of physical medicine, maybe beyond the kind of standard chiropractic adjustment.
Yeah, I have treated spinal fusion in the past, usually with needles just alongside the spine, a bit of V-stim, especially the microcurrent can be really useful for that. But, I think physical medicine is still a good fit because there's a lot of rehabilitative exercises. I'm sure Dr. Rock would love to speak about that.
Yeah, I mean, the goal with any type of fusion is you're just trying to create stability around the spine. And most of the time you're going to have some stability issues above and below the segments where you've had the fusion. So people respond really well to soft tissue, corrective exercises, and also learning like mobilization techniques to help. Because they can get really fixed in those areas as well too. So you can still gently rehab and do soft tissue techniques even if you don't do the actual adjustment.
Wonderful, thank you both. We have a question about nerve pain. Are you able to discern discomfort that may be nerve related?
Do you want to take that, Rob?
Yes, I mean, the first thing that we want to determine is if you're having what's called this peripheralization of symptoms, can we get it to centralize? So basically go back to the source. So pain has a tendency most of the time to travel down, and so we want it to kind of go back. And that's when we do a lot of repeated movements to help try to figure out if this pain is going to centralize and what we call a directional preference for that pain or movement for that pain. That's a great way in diagnosing and also treating those issues.
Right. Like the reason I refer to rock is because I want to see like that centralization occur, because I feel like that's the primary question.
Correct.
And then we start talking about like if I need to work on like muscle impingement of the nerve signaling or directly near the spine, or like I want that question answered.
Correct.
Thank you. What about pain that is possibly caused by carpal tunnel, pain in the wrist, pain in the thumbs?
100% treat that all the time with acupuncture. Yeah, works really well. There's actually good like clinical trials on that.
Yeah, absolutely. From a physical medicine standpoint, if the carpal tunnel is related to kind of an overuse injury, we definitely want to make sure that the extensor muscles on the top are strong enough so that can create more stability in the wrist. And then you're also going to want to look at shoulder as well too, and strengthen the external rotators, basically, so your shoulder can be in a better position, which can help to reduce symptoms.
Thank you. For a guest that is experiencing neck pain, do you suggest starting with the physical medicine office or the acupuncture team?
Either.
Yeah, I would say whatever you're comfortable with or what you want to try. They both are effective for treating neck pain. Yeah, and most of the time we work together. So if a patient comes in and says, "Hey, I want to try this," we refer to these services because we know that they work well together.
Right. If it's clear upper crust, I just send them straight to chiro for a lot of, physical medicine, postural changes.
Something I might recommend for that guest asking to whether to start with physical medicine or acupuncture is to schedule a free consult with both providers so you can learn a little bit more about how we would customize a treatment plan in both practices, see what speaks to you and what seems to fit with your goals the best. And then, yes, absolutely, ultimately, the maximization of that treatment plan is probably an integrative custom care model with both acupuncture and physical medicine. But again, just a great opportunity to schedule those free consults so you can learn a little bit more about how each of those providers would go about your pain. How about pain caused by digestive issues, maybe some abdominal or gastrointestinal pain?
Yeah, that is often well coordinated with functional medicine, but Chinese medicine. I just had a patient this past month or so, and we did an initial consult with an evaluative acupuncture treatment. And I could tell right away from the treatment that digestion was playing a major role in her fibromyalgia pain. So we started working right away on that. We started working on her diet. She wasn't able to see functional medicine because of insurance issues. So we just, went to town on improving her diet and improving her digestion, and she's doing a lot better now.
Thank you. We have time for one more question, and it's concerning neuropathy in the feet and if physical medicine and or acupuncture can be of benefit there.
Well, it really depends upon what is causing the neuropathy in the feet. So if it's coming from the spine specifically, yes, absolutely. But if it's from another source, then that's when Doc, maybe you can talk a little bit more about that.
Right. Like blood sugar control comes to mind there. So that's often coordination of care between myself and the functional medicine doc. And then, there are acupuncture protocols for neuropathy in the feet specifically, incorporating e-stim or spinal issues. It depends on the cause. So.
Thank you so much. We had one last question sneak in. Can you address treatment for restless leg syndrome, which I will be candid, this question speaks to me as well, and I would love to hear what you say about it.
Well, I had a good friend that has restless leg syndrome, since moved away, but there was a clear Chinese medicine cause behind his restless leg, and there's definitely a loss of blood and yin is what we call it. So he also had like a family history, so there's a genetic cause. So actually what worked well for him, believe it or not, was like a lot of Thai massage and just the circulation of qi and blood from our perspective. So really getting the invigoration of qi and blood and making sure that there's adequate amounts for him. So whether that was like changing his diet or just making sure that he exercised, since he was an avid Zen practitioner, he was sitting a lot. So there was just a lack of blood flow happening in his legs. So it depends on the situation.
Wonderful. Thank you so much for joining us today, Dr. Rock and Dr. Shana. Thank you all in our audience for joining. Thank you for these wonderful questions. We really appreciate them. We always want to make sure, in addition to the content that we prepare, that these webinars are really productive and wonderful use of your time as well. So we love these questions. Thank you for asking. Thank you for joining us. Our next Digital Doc presentation will be in 2 weeks. You can check out the calendar of topics and register at alignedmodernhealth.com. If we didn't get to your question, or if there is anything else that you're curious about, please do not hesitate to schedule a free consult or just give us a call and we'll do our best for you to make sure that you have all of the information to go out and live your life to the fullest. Thank you for joining the Aligned Modern Health Digital Doc conversation on pain management, and we hope you have a wonderful rest of your day. Cheers.
Thank you. Take care.
Thanks, everybody.